All right, everybody. I am Krista Reimel. I am a registered nurse and former healthcare administrator turned CEO and founder and co-owner of The Point Retreats. And I have the privilege of speaking this evening with Chan Shipman, and I'm going to introduce her officially here in just a few minutes. But I want to set some intentions around Chan and I's conversation as we launch this series of mini interviews with healthcare providers. And the goal here today is really just to provide frontline information from healthcare professionals who are working with patients impacted and affected with the COVID-19 virus and what's really happening out there, kind of in the front lines. The intention around this is not to produce more fear, but actually to help alleviate fear. And to really look at how we can create more of a preventative state of mind, even in the midst of a pandemic, because I believe that is possible. Because I am talking to healthcare professionals, I do want to put out a couple of medical disclaimers to protect them and ourselves. And one is being that please understand that what Chan and I talk about today is current as of March 16th. It will change tomorrow, March 17th. Likely. There will be new information. We're continuing to learn new things all the time. So please be aware that what we're talking about today is information relevant to today. And then I also want to say that if you are looking for specific information on your personal health, we would recommend that you contact your primary healthcare provider to discuss your healthcare history. What Chan and I are going to be talking about today is intended to be for just kind of general medical conversation and guidelines. Anything specific should be directed to your primary clinician. Chan and I am sure both looking at CDC and WHO statistics frequently, although I will be honest, I try not look more than once a day. If you're looking for a lot of facts and statistics, they're out there, and I think Chan and I would both probably agree on recommending the CDC and WHO as good places to get statistics, even though that's not going to be the foundation of our conversation today. So with that, I would love for you to introduce yourself, Chan.
Hey everyone, thank you for setting those intentions, Krista. I really appreciate that, because that's the baseline, right? We all want everyone to be healthy. My name is Chan Shipman. I'm a night shift trauma ER nurse here in the San Francisco Bay Area. I'm also night shift biohacker on Instagram and on social media. So I kind of play a dual role. But for right now, I think the fact that I am in the front line, you know, dealing with the midst of the chaos and the spread of a global pandemic, COVID-19, that's been my main area of energy at the moment.
Mm-hmm. Wonderful. And so with that being said, I want to let people know Chan is an incredibly busy nurse right now, as you can imagine, and mother and wife. And so I have the deepest gratitude for you taking out some time to talk to me. When Chan and I first connected and I saw her in beautiful sunny California, in the sunshine, I'm sitting in Minnesota where it's cloudy and it was snowy and I still shoved my kids outside. I was like, oh, that looks so nice. I want to be by you. But I know there's a whole nother reality that kind of waits for you at work right now. And I was just looking, I quick glanced at the CDC before our conversation, and it shows that California is the state with the second leading confirmed cases of COVID for 19, for whatever that's worth. But here in Minnesota, we're a little bit behind you, and would just love to get your overall perspective on COVID-19. You know, when we were talking about this a month ago, did you think that you'd be sitting in this place today?
Yes and no, right? There's two ways to answer that question. As I was pondering, how do I answer this question? Because at the moment, you know, yes and no is correct. Yeah. A month ago when I said, no, I'm not panicking, because I still see till this day, it's a virus. Very similar to MERS, very similar to SARS, very similar to flu. Mm-hmm. But now that I see the mass media propaganda part of it, the mass panic, I'm going to lean towards yes, because now what are we really dealing with? Are we really dealing with the actual global pandemic? Kind of in relation to mass media panic? Mm-hmm. I think they're both now interlocked and interrelated to where whatever side you stand on a month ago, now we all need to get on board. We need to flatten the curve as per CDC and WHO.
Yeah. No, that's very, very wise words and good perspective. And I think perspective is really important right now. So thank you for bringing that to that answer. So Chan and I kind of walk this line of both being in the nursing profession and medical profession. We're also people who are really passionate about integrative medicine, holistic medicine, functional medicine, biohacking ourselves for optimal health. But at the end of the day, we ultimately really care about the patients that we serve in whatever capacity we do. So we really need minds like Chan to help us keep a lot of perspective right now. And Chan, I'm going to tell you, last night I lost a little perspective, which is why I was happy to be talking to you today. I, like every other human, was at Target, and all the aisles are totally empty. And, I don't even eat bread, and I'm walking down the aisle and I'm looking at the bread aisle and I'm like, oh my gosh, there's only 2 loaves. Should I get one? And I'm like, what am I saying? I don't even eat bread. I'm like, stop.
No. Well, if you lived in the state of California, which you don't, I would say, yes, you need to stock up.
Yeah.
Because the president invoked the Stafford Act, which is normally an act used for wartime situation, right? World War II, World War I, Vietnam War, things like that. But post 9/11, post Katrina, post the fiasco of FEMA a while back, we're now enacting it for global pandemic. We're enacting it for natural disaster. It's where the president or governments, state governors can enact curfew, quarantine, shelter in place. And currently California, because of the high level and transmission rate of community acquired COVID-19, we are sheltering in place.
Yeah. So what does that look like for you day to day? And what does that mean for you in the hospital?
In the hospital, basically, it heightens it, right? Before, as frontline worker, we were, a month ago, we were confused. Why are they sending them to the ER? We have very sick patients. We're trying to protect the patient with higher comorbidities, the immune suppressant, our diabetics, our COPD patient, our restrictive airway patient that are more likely to not recover as well, to include death. And our elderly population, 65 and up. We worry about those people. So when you get walking wounded, as I call them, you're walking sniffling, you're walking coughing. They're walking. They're not altered. They just have flu-like symptoms. It compromises everybody else. It steals resources away because we need to quarantine, we need to contain. I just found in the early days, the emergency room was not the appropriate place to do that.
Sure.
I really felt like if it's truly this state of panic and emergency, we should have had medical National Guard on standby outside of each hospital, screening and quarantining. And if they show severe shortness of breath, severe, life and death, airway, breathing, circulation issue, that's the appropriate time to come into the emergency room.
Right. Do you feel like most people, given all of the kind of the social isolation recommendations and everything that's currently closed in the state of California and elsewhere, Minnesota being another one, do you feel like people are seeking out the emergency room more or less right now, given the state of things?
And that's why I appreciate when they started saying self-quarantine, or if you have symptoms or you've traveled to those countries where there is high-level cases, you should quarantine yourself. And the suggestion is 14 days of incubation period from the time you travel or the time you were exposed. I mean, that was a month ago. Now, as predicted, we are having an increased rise in community acquired cases, which is where those people are saying no to all of the screening questions. We have no source. That's our main concern now, because those cases tend to spread like wildfire. And that's what we want to do, is control and contain. And I think a month ago, if they hadn't done that, I think we would be in a worse state, but at the same time, there are, it should be spread through public official, the correct information, not spread like on social media where there's a lot of misinformation. People really do need to be careful where they get their information from.
Where are you getting your information from right now? Where do you see as credible sources?
when I'm talking about statistics and stats and current numbers, I know no one else that has the manpower to gather these information other than the CDC and the WHO, but more specifically, more relatable to your hometown would be your county health public officials. Yeah, I mean, that's just it. You know, you're not going to get it from John Smith off the internet who's talking about toilet paper,
right?
You know, or you know, not to wash your hands because, you know, I heard that, you know, you have normal bacteria that's protecting you. Yes and no.
Yeah,
You
right,
know?
right.
I think people confuse individual, you know, health versus public health. It's a whole nother ballgame.
Yeah, 100%. And I think you bring up a good point. You know, the yes and the no that you've mentioned a few times, it's kind of that a lot of times the truth lies in the middle, right?
Yeah.
And it's difficult to weed our way through that right now because it's easy to get caught up in kind of the, you know, fear-based information. And anytime you're dealing with something unknown, there is a level of fear. And I think in healthcare, for better or worse, this is certainly a different level of unknown, but it's not uncommon that when you're in patient care, you walk into the hospital and you kind of have this moment where you go, I wonder what's waiting through those doors to greet me. You know, you kind of have this, like every time you walk in, it's a fear of an unknown because you don't know what's life or death situations you're going to be greeted by that given shift or that given day. So, you know, maybe healthcare professionals become somewhat immune to that, but I do think the most important message in that is I think we become really good critics at weeding through information because we see a lot of that, you know, extreme thought, and we know we have to kind of go somewhere in the middle.
Yeah.
So I like that yes and no answer. Yeah.
Perfect example. When people are afraid, they tend to forget all common sense, you know?
Yeah.
Like they walk into the ER for something as simple as a cut and realize, oh, I should put on a mask. You guys are in the midst of COVID-19. I'm like, do you hear yourself?
Yeah.
Do you hear yourself? I have to repeat that over again to this individual. Do you hear yourself?
Yeah.
And at some point, the light goes off and go, I should go home.
Yeah.
You should go home.
Yeah, you should go home. You know, the emergency room is not where you want to be right now. I mean, it's really not. It's hard to get that message across to people in general, but it is really a matter, like you go there right now if it's a matter of life or death. Otherwise, you are just exposing yourself to things you don't want to be exposed to. So, so who should come? And you mentioned this a little bit earlier, but you know, who would you recommend coming to the emergency room right now? What kind of symptoms would you say, hey, you know what, it is really important that you come or go to your local ER?
So basically, the symptoms for COVID-19 is basically flu-like symptoms, fever, cough, you know. But if you have severe short of breath, you can't catch your breath, you're quickly winded, lethargic, because what we worry about is sepsis. COVID-19 can induce a sepsis case inside your body, and that can be fatal if not treated early with antibiotics and fluids. And then there's also patient who has restrictive airway disease. They're quickly, and 65 and up, they're quickly to have an exacerbation of pneumonia, right? All of those require drips and antibiotics, and sometimes severe cases will require airway intubation. And those are the people we worry about the most. You have comorbidities and you have flu-like symptoms, you should come in, because more than likely, all of your normal things that you live with, diabetes, all of that will go out of whack.
Right.
And you'll need our help to get it all back regulated through fluids and treatment.
Yep, absolutely. Yeah, great answer. So that kind of brings me to this, you know, my understanding is it's been a fairly heavy flu season also. So how are you differentiating those patients, you know, that seem to fit more in the, you know, the seasonal flu category versus the COVID-19 category? Or are they so similar, you just are testing for both?
So they're very similar. And the last time I checked, but don't quote me, we only have a certain amount. And the last time I checked was about 8,000 COVID-19 test cases. So that's not a lot for a state, but I think they're increasing much more now. There's even countries reaching out, you know, and saying, we'll give you some test cases for the United States. There's been some information in that area. But before we get somebody who has, said yes to those questions, the screening question, have you traveled? Have you been with somebody who's had these symptoms and have traveled to those countries? We quickly quarantine them, and then we rule out for everything else except COVID-19.
Okay.
We correlate and be in communication with current public health, our county public health, and they decide yes or no, you should go ahead and test once we ruled everything else. So more than likely, about a percentage of the time, people do pop up positive for pneumonia through x-ray or flu A or flu B through the swab. So what we try to do is rule them out and then eventually test them for COVID-19.
Okay. Have you heard of a case where they've acquired both influenza A or B and COVID-19?
I have not yet, but we've had a lot of false positive and false negative. There's been some cases where people have already started Tamiflu with their current provider, and they got scared. They came in anyway, and they actually test negative for the flu, even though we know they would have tested positive if Tamiflu hasn't been in their system. So there's been that game too, but I haven't heard of anybody having both yet. Sure.
But at this time, having to just use the resources for the testing kits wisely for those that are fitting in the higher risk category. Which makes perfect sense. Absolutely. So what happens when the emergency room is really full? Can you explain that to kind of the general public? What does that look like when the emergency room is full or the hospital beds are all taken?
That's, and that's where we go on Divert. A diversion protocol, there's certain protocols per hospital, and when we say no, not to emergency ambulances, but like your normal ambulances of transport and transfer and bringing people in that aren't a STEMI, that are not a stroke and not a trauma. We don't say no to real code 3 emergencies, but when you're on Divert, that means you're in the black or the red with your census level, right? There's no way. We're completely oversaturated. And that creates a very, very dangerous ground. One, when you get a patient that's quarantined or rule out for COVID-19, that nurse is usually one-to-one with that patient. They could be walking, they could be fine, but that pull resources away. And that means that there's not enough to handle the emergencies. Our beds are full, and it creates a really difficult situation where you're gonna have to start prioritizing the basic. Are they breathing? Is there a heart attack going on? Do they need emergency medication? And that basically, it's kind of like a risk game, should we take on more patients and risk that we might have to deal with a trauma or a code 3? And by code 3, I mean that's someone that needs intervention, life-saving intervention right then and there, or they will die. And it's really dangerous. You're understaffed, you're way oversaturated, and you can't take on any more patients. And you just pray to the ER God that you're not going to get a real emergency, and so that you can keep going. But at the same time, your nurses aren't getting breaks. Your doctors are just running around like crazy. It's just not a good environment to be in when you're trying to incorporate critical thinking to make sure that your patient and everyone stays safe. We could be on automatic mode and forget to properly gown our PPE. We could be on automatic mode and not do the correct medication calculation, or we miss a sign or a symptom. It happens.
Yeah, absolutely, it does. And
the more fatigue and the more burnt out your staff is, and the more overwhelming it is, the more likely mistakes will be made.
100%. I think it's hard to really conceptualize what it means to work a 8, 12, 16, 24-hour medical shift, and the constant flood of, emergencies coming your way. It kind of heightens your fatigue because you're on this adrenaline rush and eventually you crash, and it's overload. And nurses and doctors are humans. I mean, they're doing the best they can in every situation, and intentions are always to do good and treat well. But when you're in the thick of a tough circumstance like now, I mean, you guys are, I'm sure, getting worn out, and you're the first ones to be exposed to it too. So so it's just kind of this tough cycle that healthcare professionals are in. So with that, Chan, what are you doing personally right now to protect your own health and that of your family? Because I think what people sometimes feel the neglect is, obviously you're putting yourself in a place to care for others, you know, knowing the risks that you're assuming. But there are, you know, things that you have to look out for when you come back home and walk through those doors too. So what are you doing for you, and what are you doing to protect your family?
Oh, I knew this question was going to come up, and like, how do I answer this question without saying, well, tough, good luck.
Right.
No, I've been very fortunate that the other side of me is biohacking, and that, you know, I've been very fortunate to count my blessing and say, yes, I'm so glad I've been working so hard on strengthening my immune system, because I'm a nurse, you know, I get in contact with everything. This is not new to me. Flu happens for us, tuberculosis happens for us, measles, rubella, all these infectious diseases, you know, they all happen for us, and we get exposed to all sorts of things, even scabies, you know.
Yep.
And
we all know nurses who've contracted scabies, unfortunately.
You know, so we have become pros at wearing masks and actually over donning PPE sometimes, because our own medical disease biasm. But I'm very fortunate that back in the summer, I already started beefing up my immune system with bone broth and, you know, staying healthy and doing cold plunges and being out in the sunlight, getting my vitamin D, being able to metabolically flex between ketosis and carb refeed. Those are huge daily life that I've been working on that's kept me very, you know, disease proof. But at the same time, I don't want to say, well, if you didn't start it last summer, you're screwed. Right. Kind of true and kind of not. But what you can do currently is actually start the way of life of boosting up your immune system and making things work more efficiently for you. And you can also start washing your hands. That's the most simplest thing. 20 seconds, wash your hands. Because they're saying that the droplet within 6 feet, right? Somebody had to actually cough and sneeze in your mouth, you know, or you touch something. It's saying it can live on 7 to 14 days on surface to contact, right? And wash your hands before you touch your face or eat. That's the first line of defense right there, right? Your skin is the biggest organ in your body, and it also is the biggest protector. So that's something you have, you know, I want to empower you that you have something that you already have that's already proof if you know how to use it. And you actually incorporate it, you know. But also bone broth is very good for boosting immune system. You know, when you are dealing with a viral outbreak, global pandemic, you're definitely going to need anything that you can eat or drink to help aid in fighting it off. So they say with a virus, you tend to have a high fever, your body's going to want more food, more glucose to fight it off. Really, and that's basic microbiology.
Really good words of wisdom. And you know what I can just say from watching Chan is Chan works nights, if you haven't gathered that. And she's used this word biohacker. And really what that means is, you know, Chan and I were both educated in a traditional medicine nursing program. And so we learned how to treat and care for a lot of disease and some prevention. But biohacking is kind of this train of thought where you take things kind of to the next level in terms of preventative health. And you really look at your lifestyle to try and create kind of this optimal environment to recover and sustain in today's modern world. And that can look a lot of different ways. But for Chan and people who work night shift and shift work, you need kind of even an extra boost, I would say, because it's kind of an insult to your body every time you're flip-flopping between night and days, and you're, you know, trying to adjust to different wake light cycles, and it can really wreak havoc. I mean, there's all kinds of research articles on different things that night shift workers are more prone to getting than the average population. And then just on top of being a nurse, you're exposed to many, many different infectious agents and have to really protect yourself. And Chan has done that beautifully. And it took you a little bit, but she's putting herself out there on Instagram and Facebook, and she's incredible to follow. So if you are someone working night shift and you really want to look at ways of how you can start to improve your health and boost your immune system, I would follow Night Shift Biohacker, and that is Chan herself. She gives some really great pieces of information and tips. So thank you for starting to share that with so many people. And Chan, with that, is there anything else that you'd like to share with people who are listening today?
I do, and I'm glad you asked that, because I was like, oh, there's one more thing I want to share.
Yeah.
We talk a lot about individual prevention, right? But public health is a huge area. I really urge you, if you have symptoms or you know anybody that has symptoms, just stay home.
Yeah.
It's really huge right now that we curb the transmission rate until the incubation period is over. Yeah. And that's what they mean when they want to talk about flattening that bell curve, right? That'll take us out of a global pandemic, at least here in the United States, to an epidemic, and then slowly it'll phase back down to just an outbreak, and then it'll be over. They are saying it predicts to last until June for us, and I don't want that.
Oh, we don't want that either. No, nobody wants that. And Chan, when you say, stay home, if you have symptoms of the flu of any kind, as long as you're not having any distress, stay home. But what does that mean? I mean, can you help put some definition around stay home in terms of time? I mean, it's good to get outside. It's, good to move around, but how long should you try and avoid others if you're having symptoms?
So if you're having symptoms, it's really the incubation period is 14 days, right? 14 days you need to quarantine yourself at home. But if you're already in a state, like myself, to shelter in place, you're going to stay home until they say shelter in place is no longer active. And for us, it's April 26th, I believe. So that's a long time for us. Yeah.
Time. Wow. Well,
I know we're one of
sunshine and warm weather.
Four states. There are currently 4 states in the United States that has sustained community acquired, which really sucks.
Yeah.
But that's where we're at in California.
Okay, that's interesting to know. We're like I said, we're a little behind you in Minnesota, but they've just canceled.
That's not a bad thing.
It's not a bad thing, because it'd be better if we're stuck at home to be able to get outside when it's above 30 degrees. But it's interesting. We continue to see things close at a pretty fast pace here, and so really good reminders that you've given us.
Yeah.
And you know what I love most, Chan, is you're still smiling and you're still here with a calm presence in the midst of, I know, facing occasional storms at work, and you're balancing things at home that are changing all the time. And what I want to bring to people's attention is healthcare providers really put themselves on the front lines right now. And so half of what they're recommending is, to protect ourselves, but it's also to protect you who are caring for patients and the patients that you're serving. And I just want to say thank you for being a direct patient care provider, because you are giving a lot right now. And I just want you to know it's appreciated. In this era where we are told, put your oxygen mask on first, I recognize that you probably put yours on last a lot. And you're honored and respected for what you do and what you give. So thank you for that. And if somebody is out there wondering, what can I do for someone else? I'd encourage you to think about your healthcare providers. I mean, there's going to be a lot of people in need ahead. And we tend to think that healthcare providers kind of have it all figured out and they're fine. And healthcare providers need some pats on the back and some thank yous, and maybe a cup of coffee, or, heck, at this point, like drop off a roll of toilet paper on your, in your mailbox or your front doorstep. But don't forget to just acknowledge and thank your healthcare providers, because you're doing a lot right now. And you're still giving me this time and conversation. So thank you for that, Chan.
You're most welcome. And thank you for thinking of us.
Absolutely. So sending a lot of love to you in California. I wish you nothing but health and happiness. And I know we have sunnier days ahead like you are having there. And in the midst of all of this, together, we're going to stay calm and stay present and stay grateful, and just know that I have much gratitude for you.
Thank you. Have a good day.
Thank you, Chan. Bye-bye.